Today, we're going to talk about the Appreciative Inquiry framework for nursing leadership. So, when you become a nurse practitioner, as you go through your journey, you may become a leader in a hospital or in a clinic or something. As a nurse, also, most of our nurse practitioners have been like directors or leaders. And appreciative framework or inquiry gives us a tool or mechanism to apply change. So, appreciative inquiry focuses on potential and positive elements rather than fixing failures. So, for example, let's take a um, nurse manager at a hospital, and she is excited about her leadership role. She quickly realizes that staff morale is low, turnover rates are high, and team communication is breaking down. She feels overwhelmed, but instead of focusing on failures, she decides to approach it differently with appreciative inquiry. Okay. Now, what she does is what nursing leaders look a good nursing, exceptional nursing leadership looks like. Instead of pointing out the inefficiencies, she studies the hospital and finds that pediatric unit is doing well, as an example. Nurses are very highly engaged, teamwork is seamless, satisfaction scores of patients are all time. So she defines her leadership goal as to create a culture where nurses are valued, supported, empowered to provide exceptional patient care. So so for example, she took a unit, she saw what was working, and now she defined what works based on the pediatric unit. So that's the definition. Now let's go to discovery. Now, in discovery, she identified strengths and opportunities. So rather than dwelling on the problems, she gathers the team and facilitates a different discussion. What makes a great work environment? Can you recall a time when teamwork felt effortless? What strengths do we have already have? So by asking all these questions, she also identifies the problems, but also identifies the strengths. So discovers that nurses most fulfilled when they have strong mentorship and clear communication and sense of professional growth. Okay. Now, next one is dream. In the dream part, um, Sarah asked her team to dream big. That is, if you could design the perfect nursing team, what would it look like? So she's getting input from all the staff and trying to see what is the perfect team or group look like. Okay. Now, based on that, then there is goes into design. So you design a mentorship program, you share a governing model where nurses have voice in decision making, your monthly appreciation events, wellness initiative, all that. So, what are the tools or steps which can be taken to get to where you want to be? Okay, now with a solid action plan, Sarah begins implementation and new nurses with experienced mentors. She pairs new nurses with mentors. She sets up regular team meetings and collaborates with providing leadership training. So, so these are the all the D's, 5 D's, which take in appreciative inquiry. Okay, I hope that helps.